Yeah, hello and good evening, everyone. I hope you can hear me and you can see the screen. I assume you were expecting a different voice to hear. However, Babak is on a business trip, so it will be my honor to moderate this new webinar, the latest webinar. In the past, we held 3 different webinars in regards to tracking methods and digitalization within the CSSD, with partners from various corners of the world sharing their knowledge with us. We had Layerjot as our first start in this new season. Then we had our partner from Finland, Atmos Group. The last webinar was about our partner in China and his digitalization in the development of the CSSD. And we are proud that Layerjot has returned. So we have again people from all over the CSSD joining our webinar. I have to admit that Oman is still the strongest participant read on this webinars. So, but I'm sure our other countries will be catching up on that one. Kindly note, as we did it in the past, that this call will be recorded and maybe posted on LinkedIn and the YouTube channel afterwards. So feel free to use the chat or raise your hand if you have any questions. If you don't mind, keep your mic on mute if you have nothing to say, and turn off your camera unless you are speaking. Okay, Babak, we all know, as I said before, unfortunately he cannot join you this time, but he sends his warmest regards. In the email, we already asked you to download the SID 2025 mobile and web app. So if you haven't done it so, please follow the link. I will put this link also in the chat later after I'm finishing this introduction. You all know and we are very proud in collaborating with them. So Ahmed Baggashi, are you there?
Yes, welcome.
Thank you for joining us again. It's always a pleasure hearing your voice. So if you have anything to say, please feel free.
No, I just want to really thank the speaker. It was excellent choice because they have informative presentation and we learn a lot with them, and the feedback of audience, it's really something that we are happy for to hear from them, and still we need to learn more and more from your expert speaker, and to know about the new technologies in CSSD. And thanks to Atmos Group and to our the strong speaker, I think I can pronounce his name, Etay or Etay. So thanks to him very much. Thanks to Sir Babak, he's the leader of this, series of education. And we hope to continue with you this cooperation to teach more audience around the world. Thank you so much.
No, thank you for your kind words. And with no further ado, I just want to give you again today's agenda. We heard already Dr. Baggashi. Thank you so much. Then Etay is the one from the US, Layerjot, who we will have the pleasure again to hear further information about his products. We will do a Q&A, and anything you want to ask in the meantime, please feel free to add your questions in the chat. How and where to follow up? I think this is also known from your side, since it's not the first time you are joining our webinars. So please welcome Etay from Layerjot, the US. And I would say, Etay, it's your turn now. I will stop sharing.
Thank you, everyone, for having me again. I truly appreciate it. It's been a pleasure, and we are very happy for all the feedback we have received from the previous session. So we are very glad to be part of this series of webinar and help educate and contribute to the amazing community of sterilization departments and operating room. So let's start. We all kind of know that the operating room is kind of the heart of the healthcare system for hospital. But I just want again to acknowledge that as far as we are concerned, you are the heart and you are the soul of this operation. Without you in the sterilization departments, all of the fancy surgeries and everything else will not be able, and patients will not be able to get the care that they're getting. So just thank you, and I'm excited to work in this domain, which is really meaningful and contributing to everyone. So when we looking at sterilization departments and we're looking at what are we doing here and what is the goal of all the efforts and all the long hours and training that you guys put into this, at the end of the day, it's really to give the surgeon the right instrument in the right condition every time. And that means that we need to be able to do two things very well. We need to follow up the instructions in the count sheet, making sure that we are collecting the right instruments, but we also need to know the instruments very well. And in many cases, we need to be able to not improvise, but really to know what instrument could have some similar equivalents that are good enough, be able to close any gaps in inventory. And really the operation in the sterilization department is relying on you as people to be able to do all of these things. So when we started Layerjot, one of the first questions we ask is, do you have what you need to succeed? Like, do you have everything that you need in order to be able to do all these tasks, complex trays, and all of these special instruments and qualification for the instruments, like checking the scissors are sharp, making sure there's no bioburden, do all these inspections, making sure the tubes are clean. Do you have everything you need to do that? And it's not just technology or knowledge. Do you have the manpower? Do you have everything you need to be successful in this stressful work that is supporting a lot of medical staff in the operating room? And the reality that we face is that most count sheets are basically not accurate. They just don't have enough information in them. They are managed and updated by hand or offline system, like in a word processor or Excel. And they have no easy access to IFU, not even pictures of the instruments. Many of them are missing the vendor or SKU to know exactly what is required. And that is not, this is not just you guys. This is a common thing, and a lot of facilities in the US do not have a tracking system, and they manage these count sheets by hand. And as you can see here, this is an example for a real count sheet. Another interesting challenge is that a mid-sized hospital with 10 to 20 ORs have over 30,000 unique instruments in their inventory. It's just an amazing large number of instruments. And one of the things that happen is that these instruments coming from different vendors have different small variations. Sometimes the hospital change a vendor and now the count sheets are mentioning one vendor, but the actual instruments are from another vendor. And when we're looking at training and getting your teams be ready to handle these instruments, the learning curve is very long. Like it's taking a long time for people to learn instruments and to be able to identify them. So if a person after a year can recognize over 500 instruments, after 5 years, they can do 2,000 instruments. And there is a limit to how much we can observe and know. So in the US and maybe in your zone as well, in your region, there is a lot of turnover and new technicians are always coming in. So to be able to know what is the instruments and how is it related to the count sheet is an ongoing struggle. And it's really hard to catch up with that. And one of the last things that is kind of amazing is that you guys usually do not have an IT budget. You don't have a lot of money for that. You have money for buying new instruments that got lost or need to repair. And if you do have budget and a tracking system is to be installed, it's taking a lot of time to fully implement that. So these are kind of the three main challenges that we see that kind of impacting your way to be successful from a data and budget side of things. Personally, what really, drives me crazy is that after all the hard work that you have done in preparing all of these trays and all of these preference cards and carts and rolling out into the OR, the dirty secret is that half of it is not going to be used. So there are many research that was done across different line of services, from orthopedic to cataract to general surgery. And usually between 30 to over 50% of the instruments that were prepared for surgery were not used. And not just this time, were not used over a long period of time across many cases, which means that the hard work that you have done is basically wasted because you need to go process everything that was opened and not used. And this is a problem across the industry. It's a known secret. And one of the challenges that we are trying to address here is how to turn that known issue, that research that was done, into a practical solution that will allow us to really reduce the size of trays, standardize them, and reduce the load on your teams. So let's start. We see the world of surgical logistics as kind of an endless loop of activities. So from you getting a tray that go into decon and get cleaned after a surgery to be maintained, all the instruments need to be maintained, checked in, checked out from an inventory, to do assembly, sterilization, and then hand it off to the OR. The OR is using it and then bringing it back to you. So this is the ongoing cycles. We have companies or hospitals we work with that do not have enough trays to cover 1 day of surgery. So some of the trays need to be processed multiple times a day in order to go and be used in the OR multiple times. So this is a very stressful and ongoing cycle that you guys are in the heart of. And the key challenges that we are trying to address and help you with are the following. One is the workforce shortage. In the US, there is about a third of the positions or the original positions that were in the sterilization department are not currently manned. And new people are joining and leaving within 2 years. So it's really hard to keep the workforce educated and engaged for a long period of time. Knowledge is a problem. Many smart and experienced technicians are leaving, and that means that they're taking their knowledge with them. There is a lot of knowledge that they just have, and the current way to share that knowledge is to have people shadowing them and have people looking how they're doing things and just learning from them. And this way of mentoring is very time consuming and it's not really scalable. And many organizations are at the risk of losing valuable knowledge. And the last thing around the SPD is that you still are required for a high quality of products. You are required to have the right instruments in the right tray, in the right condition, and it's really hard to keep quality. And I often joke that this business is, instead of being data-driven, it's more drama-driven, because every time there is a quality event, something is missing or not in the right condition, the operating room, have complaints, yelling, and so on, asking for things to be brought to them very quickly or re-sterilized very quickly. And all of that is adding a lot of stress. So what can we do in order to create this workflow and these activities more efficient for you and give you a peace of mind that you have done everything the right way? And the other thing that we've been focusing on is reducing the waste that's happening in the operating room. And again, this is not the fault of the surgical techs or the surgeon in the operating room. What usually happens is that a tray was created a long time ago by a doctor that probably retired or moved on. And then more and more doctors are just asking for more instruments and things get added, but no one knows how to reduce the tray. And we will address that soon. So this is kind of how we look at the challenges and the abilities for us to address and to try and get this whole system more efficient and your job easier. So what can we do in order to support you and to help you with that? There is basically 3 tiers of activities. First, in order to be able to know the instruments, be able to have information that is accurate about these instruments, there is a need to be a layer of directory or a catalog. Then we need to help you guys to be able to accurately identify these instruments. So you need to be able to know what is the instruments and then access the information about this instrument. The next tier that we are helping is with the count sheet management system. Like I mentioned, many of you do not have a tracking system and count sheets are managed offline. How can we help with that? And as a subset of that, how can we turn the work that you have put into the count sheet management system into a training system so you can onboard your staff more quickly and ensure their work is in the right quality. And the third layer is how can we actually do utilization analysis at scale? Currently, some of the projects that are doing for this utilization analysis are kind of research or one-time project by universities. Sometimes it's done by an organization that goes in the hospital and do surveys and track the activities in the operating room for a few weeks or a month per surgery. And then this is a very long 12 to 18 months procedure that is very expensive. So how can we help to bring that data quickly and allow you guys to trim the tray in a way that the surgeons and whole staff is agreeing with? Yeah, so if there are no specific question now, I'll just start talking about some of the solutions. So as for the catalog, Layerjot is currently maintaining the most complete and accurate catalog of surgical instruments. We have access to accurate specs, IFUs. We have over 3.5 million devices and instruments in the catalog. We've been working with over 2,000 vendors. We especially currently focusing on the US, but a lot of these instruments are available to you as well. So we've been working with organizations like the FDA, and we have direct relationship with key manufacturers like Aspen, that used to be Symmetry, Askelab, V. Muller, and more. So we are working directly with these vendors in order to take their PDF-based or paper-based catalog and make them available to you online. And our goal is to be able to take any instruments that you may use and create access for you to have page like that, access to the information, the specs, pictures, general information of use, inspection checklist, and other things that will be useful for you. So that is the first layer of a solution, is building this big catalog that we maintain, and we're using different technologies and AI in order to match equivalence and to track all the different vendors that got bought by another vendor, and the instrument line are just kind of confusing as the name change. For example, Aspen versus Symmetry Surgical. Another thing that we've been doing is working on accurate identification. So what you see here is one of our demos where we're using computer vision in order to recognize instruments. Even very similar instruments we can identify very accurately. And we use different techniques to recognize the instruments. We can read a barcode of the instrument, we can read the SKU of the instrument, and we can even recognize by shape. What is unique about our technology is that we can recognize instruments in different states. Like you can see here, the scissors can be open or closed and so forth. And that's something that is unique to Layerjot, and provide you with access to that is important for us. So in order to do that, we have released the SID app, SID, Surgical Instrument Directory. And that tool is free and available to you on your PC, but also on your mobile. And I'll show you some of what we can do with it. So when you log in, one of the things,
and
if you're interested...
Sorry for interrupting you, Etay. I put the link on the chat. So if you haven't downloaded it yet, please feel free to do it.
Yeah. Thank you, Iris.
Please continue.
Yeah, so what you can do with this, if you're looking for a specific instrument or just a category, you can use the text search to, and this is, we do talk to Iris, so I choose an example like that. You can start
How
searching.
Lovely is that?
We have autocomplete. You can look even up to size, and you get information about different vendors, different instruments. Many of the instruments that we have, we took high quality catalog photos, and including drawing from the manufacturer. So we really get the ability to learn and know the tool specification visually and through data. We also provide access to vendors' IFU, so you can easily look for sterilization information and other things available for you online, and also on the web, on the mobile, and I'll show it in a second. Another thing you can do with SID is search per SKU. So if you have known the SKU, you can just enter the SKU, and you will get information about this instrument. Some of the instruments, like I mentioned, beyond the photos and the textual information, have checklists that we have created with senior SPD technicians. So you can benefit from that, and you can also contribute and add checklists and pictures and other things yourself. We will moderate that, and we will add them to the count sheet, to the SID detail page per instrument. So there is a way for you to contribute and to add more photos and other things, because the instruments that you have may look a little bit different. So we can add it so everyone can benefit from that in the SID community. we already have over 10,000 users that use it on a daily basis. Now, one of the things that we kind of used in order to assist you is our ability to analyze and read different type of count sheets. So your world is focused on filling up the count sheets and making sure the recipes are done correctly. In the last version of SID, we added the ability for you to upload your count sheet and to get information about the instruments in this count sheet. So you can go into the new count sheet scanner and you can basically upload a PDF or Excel of your count sheet. It may take up to 30 seconds for us to analyze it. So I'm just showing you here the example of this count sheet that I'm currently uploading. So it's a standard count sheet from a tracking system, but we can read any type of table. And then what you get is access to the information about all the instruments that are mentioned in the count sheet. So even if you just want to look at what you currently have, you can upload your count sheets and get access to all of that rich of information from the Layerjot catalog using SID. So this is a very powerful tool for you to use on a daily basis, and you can go and just download it and use it for free. The last thing that is more unique to the mobile side of things is the ability to recognize surgical instruments by photo. So here I'm zooming in and the app automatically read the barcode. But if even I don't have a barcode, like on this side, I can take 2 photos of the instrument, and the iPhone or the Android phone is capable of identify the instruments and give you access to the information on your phone. So SID is really complementary to your current count sheets and give you access to additional information that you want. And if you are using it, for example, you can use the scanner to take a photo of a count sheet to get access to information. You don't necessarily need to have a PDF. Like I mentioned, you can recognize instruments by automatically focusing on their barcode, on a SKU that is written, or basically on shape, and have access to everything I showed you on the web, on the mobile phone as well. So if you haven't downloaded it yet, you can take a photo of this QR code on your phone, and it will take you to the link, or you can go on your browser to sid.layerjot.com, and you can register there. It's free, and you can use the link from Iris as well. So now we kind of took care of the first 2 layers. We built the catalog. We have the ability to actually identify instruments, and we share that with you for free. That's the first tier that we are doing. The second tier layer is how can we work to assist you with count sheets and with training. And in order to do that, we have created Count Sheet AI. And Count Sheet AI is a web-based solution that requires no installation. You can manage, edit, duplicate, print all of your count sheets. You can leverage the Layerjot catalog to create count sheet or to fix the current count sheets you have. And you can use it in order to train your team on the count sheets and on the instruments. So let's see how it works. The screen you see here is the list of count sheets. So you can manage all of your count sheets. You can always search for a specific count sheet, and then you can go and edit it or just go into it to see how it looks like. In this case, you are moved into what we call the tutor. This is both the read-only version of the count sheet that you can share with your team, that they can learn, and you can add photos about how different sections of the trade should look like. You can search for a specific instrument or a category. so people can have access to this type of information and they can learn the instruments in the count sheets and be ready. And then they can, again, review information per instruments and they can print it. So you as managers can manage and create count sheets, and the rest of your team can have access to these count sheets, be able to print it where they need to, and have high quality printout available to them. So that's kind of one thing that you can do. Another thing you can do is edit. In this case, we're going to duplicate in order to do some edits. So you can edit this new count sheet. You can change its name. You can go to a specific section and add photos and instructions or even videos how to assemble it. You can decide you would like to delete an instrument, or you can reorder very easily the different instruments, and you can search to add new instruments. And again, this is the same catalog as SID, so you can just select a specific SKU, or you can search for a category or a class of instruments that you would like to add. I don't know how I chose Iris again. I guess it's Faith. And you can see all the different iris scissors available, and you can, decide how many you want. And for example, we're going to choose this Ascalap one and choose 3 of them. So now they've been added to the count sheet. So this is how simple it is to manage your count sheets. You can also import your existing count sheets, and we will fill up these for you. And we can also, if you register through the link that we will share, we can also help you to upload 10 of your count sheets. And if you need help with more, we can work with you in order to populate your system with the count sheets that you need. So this is Count Sheet Manager and the tutor component in it that help you to train and make the information about the count sheets and the instruments available to your team on site, but also on the go if they're using a mobile device like an iPad. One cool thing that we added is that now that you have a nice printout, one of the things you can do, every page in this printout has a QR code. So when you're using SID, one of the things when you go into the count sheet scanner, instead of taking 30 seconds for it to be able to read, as soon as it sees the QR code, so I'm just moving my hand, it quickly recognizes the count sheet and can give you all the information you need about the instruments in the count sheets. So you can envision having a printout of the count sheet, and then at the workstation, give your team the ability to easily access information about each item in the count sheet by using a mobile phone and scanning this information. So that's another way that we kind of tidying up the tools that we give. Count Sheet AI works hand in hand with the SID app. So from a mode of, it's hard to maintain count sheets, we got to the point where managing and teaching count sheets and instruments become easier. And again, if you take this, click this link or scan this QR code, you will get to a registration form that allow you to fill up the information and get help and discounts for the adding count sheets into your system. So I'll pause here for a second.
I think this is an amazing tool that you are providing, Etay. And I'm 100% sure that it will ease the burden of the CSSD staff. So thank you again for sharing this one with us. Are there so far any questions that might come up? Looks like not. Everyone is impressed. No questions asked. But anyway, we are always there to support you. So don't be shy and raise your voice or raise your hand or put your question in the chat.
Excellent. Yes, we're always here to support, and with Babak and Iris, yeah, you can contact them. They will follow to us, or you can go to the Layerjot website and ask questions. So now that we kind of taking care of the information and the count sheet management, let's talk about utilization analysis. So if you ask a team of surgeons to go and take a tray, so I'll give you a real example. We are working with a group that has cataract trays that have over 50 instruments, 56 actually, and every other team is using less than half of it. So they just want to make sure that they can trim this tray. When they get a team of surgeons to talk about it, they end up with a bigger tray. So asking surgical team to decide which instrument to take out is an impossible task. Everyone said, but what if I need this or need that? So this is where we believe that data is better than opinions. And in order to do that, we need to collect a lot of data to convince the hospitals and the surgeons that instruments can be removed from the tray, or at least put in a pill pack aside so they don't have to be reprocessed every time. And we developed the technology that allow us to do it at scale. We call it OR stats, and it's a combination of our capabilities and the catalog in order to utilize it for analyzing what was used and not used during surgery for any surgery that you want. We have developed two types of cards. The one on the right, you can see, is the card that has both of them running off an iPad. The one on the right is also using a PTZ camera, which means that this camera can move around and track things. We use that when we have the need to be in the OR, but to be a bit further away from the area we would like to observe. We're currently observing mainly the Mayo stand, where instruments are placed in order for by the technical surgical tech to be able to give it to the doctor afterwards. And that allow us to really track from far what was used and not used. On the left side, we have another version of that is just the iPad, and that is for settings that we just need to have. We have a clear view from a meter away for that Mayo stand, and the iPad camera is good enough for that. Both of these cards can work with power or with battery, so they can move around in the OR and basically be invisible for the team. And the app that we have developed that is running on the iPad is very, very simple to operate. We can integrate with scheduling systems, but also we can keep things very simple in order to know what we are observing and knowing what type of trays to expect in the surgery. So the way it works is you can potentially enter the procedure ID or any information that is relevant. Otherwise, we just use the date and time to know which surgery it was. And you just start recording. And all we need is for you to place the instruments half an inch or 2 centimeters apart, and the system analyze and identify the instruments as they've been placed. Instruments that did not move are not identified again, so only the new instruments are get identified, and this is allowing us to keep account of what instruments was used and how many times. And that basically, when you're done, you just click stop and you have all the snapshots that we're taking with the different instruments. Automatically, it could be sent to analysis, but if you want to delete a specific frame, you can do that and then send it for analysis. It's that simple. So all the information is analyzed and sent to our servers, and we can give you a detailed report over time on what was used or not used during the surgery. Our system help you to look at the count sheet and see usage over time to understand what needs to stay in the tray or what could be potentially removed from the tray. We can also work with partners who are currently doing this service manually and empower them to be able to collect more information more quickly. Our goal at the end of the day is to show you a dashboard of all the different surgeries and the utilization numbers, allowing you to start a conversation and back up the requirements or the request for trimming with the surgical team based on data that we have collected with you. So OR Stats is kind of the last pillar of the solution that we build a catalog, we can identify surgical instruments, we help manage the count sheets, we then see what is used or not used in the count sheet, and then you can take it back and update the count sheets very easily moving forward. So analyzing and optimizing can be an ongoing activity that you can use Count Sheet AI and OR Stats for. So just want to say thank you again for all the hard work and all your passion that you're putting into this profession. I'm always in awe and admiring the hard work and the commitment that you have. And if you have any further questions, feel free to ask. Here are all the information to be able to download Seed, to try Count Sheet AI, to learn more about OR Stats, and to contact us through Babak and Iris in order to get some discounts on Count Sheet upload for you guys. Thank you very much.
Yeah, I also have to thank you again for this amazing presentation. I think most of us are all overwhelmed that you put so much effort in creating this free SID, as I would say, the SID. And based on this one, you can already identify what might be in your CSSD. Of course, if you want to go further, and not everyone is working for free, of course, we add the second and third layer, as Etay was already explaining now. I think I have no more words. It's just thank you, thank you, thank you. And well, is there any further requests or clarification or comments from the lovely audience here? Well, Dr. Baggashi, any last words from your side? Dr. Baggashi, did we lose you?
Thank you so much. Everything is clear, and still we need more information, more details. And I think we are going to arrange for, a long program, comprehensive program, especially with our speaker, Etay. Thank you so much. For me, it's very clear, no question.
Amazing.
Thank you very much. Shukran.
So it looks like everyone is happy, everyone agrees, everything is clear. So I would say this is the first time we will finish our session on time. I really appreciate all for you coming in and following our fourth webinar. New are coming, are on the way, so please we keep you posted what's in the pipeline. And we are looking forward to seeing you next time. Thank you again.
Thank you so much. Thank you.
Thank you very much.
And one additional information. I know it is to summarize this whole session, it was definitely a long learning curve for everyone memorizing instruments, and especially if you don't have IT budget. But we are confident that it will be in your benefit when you start with the SID first. And just to say again, a very warm thank you for all our participants. And we will share the recording afterwards so that you can review it at your own pace. And also with the capturing, which you can add in the screen, so you can see the whole webinar in your own language. So thank you again and goodbye.